Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi, and on this episode, we are going to break down a topic that is in the news today and has been a topic of discussion for a long time in sports industry. It's understanding chronic traumatic encephalopathy, CTE. This is going to be the ultimate deep dive. So we're venturing into a complex, fascinating, and deeply troubling topic, chronic traumatic encephalopathy, widely known as CTE. If you've been following sports like football, boxing, or even wrestling, you've probably heard this term thrown around. In recent topics, there's been news about events that have gone on in New York, and this is a topic that has received a lot of information being thrown at it, but a lot of people don't understand what it is. So I'm going to hopefully help with that. So what exactly is CTE? How does it affect the human brain? And why has it gained so much attention in recent years? This is the information. We're going to break it all down. We're going to do definitions, causes, symptoms, anatomy, diagnosis, treatments, and how it can reshape a person's life. Plus, we'll explore some related topics. So grab your headphones and get ready for a deep dive into one of the most pressing issues in neurodegenerative health today. So let's start with the biggest question. What is CTE? Chronic traumatic encephalopathy is a progressive and degenerative brain condition. It's primarily associated with repetitive blows to the head, such as concussions or other forms of traumatic brain injury. CTE was first described in the 1920s by Dr. Harrison Martland in boxers, which he called punch-drunk syndrome. However, modern research has expanded our understanding and revealing that CTE can affect anyone exposed to repetitive head traumas, not just athletes. So what happens in the brain? Chronic traumatic encephalopathy occurs when repeated brain injuries lead to an abnormal accumulation of proteins called tau. Tau forms tangles in the brain and disrupts its normal function. Over time, this results in gradual death of brain cells and irreversible damage. As a side note, just one of the main problems with Alzheimer's is also tau tangles. So it's something to think about. What's happening inside the brain? So next segment is we're going to get into the anatomy of it, right? Let's get into the anatomy of it. What's happening inside the brain? Now it's time to dig deeper. What exactly is CTE doing to the brain on a cellular level? This is where science gets both fascinating and tragic at the same time. At the heart of CTE's impact lies a structural protein called tau, and understanding its role is critical to grasping the damage caused by this disease. The role of tau proteins. Tau proteins are normal proteins and a healthy part of a brain cell. They act like a support beam in neurons, stabilizing structures called microtubules. These microtubules are essential for transporting nutrients and other materials along the neuron, essentially allowing brain cells to communicate between them effectively. But in CTE, taus become the villain due to repetitive trauma, usually from head injuries. Tau proteins undergo a process called hypophosphorylation, where extra phosphate groups are chemically attached to the tau molecules. Here's what happens next. Destabilization. Hyperphosphorylated taus loses the ability to stabilize microtubules, disrupting neural transport and communication. Clumping. Tau proteins start to clump together in fibrous tangles known as neurofilaments. fibrillary tangles when they spread. So these tangles initially form in small localized areas, but eventually spread to other regions of the brain, worsening the damage over time. These tangles don't disrupt cellular communication. They actively kill brain cells as the condition progresses over decades. The cumulative damage causes physical shrinkage of the brain, a phenomena often seen during autopsies in advanced cases of CTE. That's why they say, if you looked up any information about CTE, most times they can't even diagnose it until someone has passed and they do an autopsy on the brain. Key regions of the brain in CTE. As the tail tangles spread, they tend to concentrate in specific areas of the brain, each responsible for different functions. This localization explains the unique and varied symptoms associated with CTE. Okay, so let's get into this. Frontal lobe. What do? The frontal lobes are your brain's control center. They regulate executive function like decision making, problem solving, impulse control, and emotional regulation. CTE impacts the part of the tail tangles into the frontal lobe, leading to poor judgment, reckless behavior, emotional instability, such as unpredictable mood swings, loss of impulse control, sometimes resulting in aggression or violent outbursts. Now let's turn our attentions to temporal lobe. The temporal lobes are heavily involved in memory formation, language processing, and recognizing complex patterns. As temporal lobes are damaged, individuals with CTEs often experience progressive memory issues akin to early Alzheimer's disease, difficulty understanding or producing speech, confusion or lack of focusing during conversation or tasks. The amygdala. The amygdala is the brain's emotional hub, responsible for processing fear, pleasure, or aggression. The amygdala, when damaged, doesn't just create emotional change, it amplifies them. This is why people with CTE may experience extreme anxiety or paranoia, heightened aggression or irritability, reduced ability to empathize or connect emotionally. Now let's look at the hippocampus. The hippocampus is essential for creating new memories and managing spatial navigations. In cases involving the hippocampus with CTE, people may struggle to retain new information. Navigation or spatial awareness can worsen over time. That means they don't understand where they are, maybe in how much, where they are in the room or where they are in the area. Lastly, let's look at brainstem. The brainstem regulates autonomic functions like breathing, blood pressure, sleep, or motor control. In advanced CTEs, tail tangles can disrupt these essential autonomic functions, causing severe motor coordination problems, potentially life-threatening complications such as irregular heart arrhythmias or disrupting breathing. The cascade effect. The changes caused by tail tangles don't stay isolated in one region over time. They have a cascade effect. Neighboring brain cells are affected as tail-related tangles spread outward. Cellular communication network fails systematically, impairing cognitive, emotional, and motor function. Chronic inflammation often develops, furthering compounding the damage. Additionally, the brain's natural ability to repair itself becomes limited. Neurogenesis, the creation of new neurons, slows, while existing neurons continue to die off. Over time, this leads to global brain dysfunction, where multiple systems fail simultaneously. Advanced cases of CTE reveal shrinking brain regions, particularly the frontal and temporal lobes, alongside visible scarring and widespread tail accumulation. How does this translate to symptoms? So the anatomical damage done by CTEs translate directly into conditions' hallmark symptoms. For example, mood swings are tied to disruption in the frontal lobes and the amygdala. Memory issues result from damage from the hippocampus and the temporal lobe. Aggression arises from altered frontal lobe connections combined with emotional dysregulation in the amygdala. In late stages, physical coordination issues and speech loss stem from the brainstem and motor cortex deterioration. That's why symptoms tend to worsen as CTE progresses. The physical damage is cumulative and cascading along different brain regions. So let's conclude this part of the for this segment. So what we see in CTE is a multi-layered attack on the brain. Tau proteins destabilize neurons, leading to cellular death, inflammation, and widespread disruption across vital brain regions. This is why CTE isn't just a physical injury. It's a disease of progressive degeneration that we are only beginning to fully understand at the anatomical level. Staying aware of how these processes unfold is critical for understanding symptoms, managing them, and ultimately finding new treatment approaches. Next segment, segment 3, prevalence. Who does CTE affect? So that might be the biggest question you're wondering. Now you're wondering, how widespread is CTE? While we don't have precise prevalence rates due to the challenges in identifying the disease during a person's lifetime, researchers have identified several key populations at risk with CTE. So CTE is the most common among individuals exposed to repetitive head injuries over extended periods. Let's explore who is most affected and, crucially, at what age does CTE develop and reveal itself? So who's most at risk? Several groups face heightened risks during the nature of their activities or experiences, often involving repetitive brain trauma. So first, athletes. Sports are a major contribution to CTE developments. Football players, especially linebackers, linemen, endure repetitive blows to the heads throughout their careers, even during practices. It doesn't have to be just those two positions. It could be any position on the field, right? Let's be realistic. Everybody's is affected. It's a full contact sport. Next sport that we'll talk about is boxers. Boxers are one of the earliest groups diagnosed, as it was historically called punch-drunk syndrome, as they sustain high-impact hits directly to the head during their matches. Next group is rugby. Rugby players and wrestlers are also, so we're going to put rugby and wrestlers together. They experience similar repetitive head trauma due to the physical nature of the sports. Lastly, on the athletic list is soccer players. They're not immune to this effect either. Frequent headers of the ball may contribute to subconcussive injuries over time. You don't think of it, but the soccer ball could be hard, and if it's being hit from a long distance, it could have a lot of force, and those traumas over time is what they're talking about, subconcussive. So you might not have a full concussion, but over time, those micro traumas or micro concussions can lead to problems. The next group that we're going to talk about is military personnel. Combat environment presents unique risks, especially from explosive blast waves near the head. Repeated concussive forces from explosions or physical injuries during training or development are linked to long-term brain damage resembling CTEs. The last group that we'll talk about is victims of domestic abuse, domestic violence. People subjected to physical violence can endure years of repetitive head trauma, making them vulnerable to developing CTE later in life. This is an underexplored area, but warrants attention due to its relevance outside the sports or military context. When does CTE develop? One of the most challenging aspects of CTE is its delayed onset. The damage begins when repetitive traumas occur, but the disease often stays silent for years, sometimes decades, before symptoms appear. Here is a closer look. Age when trauma happens. CTE often begins in young adulthood for individuals exposed to repetitive head injuries. Many athletes sustain concussions or subconcussive impacts during their teenage years or early 20s. Military personnel may experience head trauma in their 20s or 30s due to combat exposure. Victims of domestic abuse might endure trauma at a widespread age, depending on their physical circumstances or personal circumstances. Age when symptoms appear. CTE symptoms are typically delayed, meaning you won't see them immediately. Effects of the injury. Early symptoms are generally surface between the ages of 30 and 50, though it can vary depending on the severity and duration of the trauma. Okay, so let's go look at early onset CTEs, 30s or 40s. Personality changes such as mood swings, impulsiveness, irritability may begin to surface. Late onset, 50s to 70s, cognitive decline, memory loss, and symptoms resembling dementia become prominent as the disease progresses. This long latency period is one of the reasons CTE remains so difficult to recognize during someone's lifetime. Many individuals might associate their early symptoms with simpler issues like stress or mental health issues without realizing the deeper neurological implications. How common is CTE? The exact prevalence of CTE is unknown, primarily because the diagnosis is defining. When you define it, it requires an autopsy. So therefore, the ability to have an accurate number is very difficult. However, findings from studies, so there are a bunch of studies that I looked at, and the findings suggest that an alarming glimpse into how widespread the condition is. By the numbers, at Boston University examined the brains of 111 deceased former NFL players and found that 99% of them showed signs of CTE. 99% out of the 111 that they examined showed signs. That number really set me back into my chair, to be honest with you. When I saw that number, I was like, wow, this is something that is not talked about enough. And unfortunately, there are events out there that came about which brings it to the attention to the public. But 99 out of 111, this is something that really needs to be analyzed much deeper. Among those studies in contact sports such as boxing, hockey, and rugby, similar alarming rates have been observed according to the Boston University study. So not everyone develops CTE. It's important to clarify repeat head traumas doesn't automatically guarantee CTE. Again, let me repeat that. It is important to clarify repeated head traumas does not automatically guarantee CTE. Factors such as genetic predisposition, certain individuals may have a higher vulnerability to TEO accumulations and spreading. Cumulative trauma, the number and severity of head injuries, including subconcussive hits, contribute greatly to the CTE risks, and the age of first exposure. Sustaining trauma during critical brain development periods, such as adolescence, can increase the ability later in life to develop it. So what it's basically saying is when you develop this as an adolescent, like if you're playing football or hockey or boxing or wrestling during your teenage years and you're getting repeated concussions, it is something to be aware of, right? It is not something to ring the alarm bell, but it is something to be aware of, because when you're developing during that adolescence times, your body and brain is still developing, and that can affect how your brain completes its development. So let me conclude this segment. So while CTE isn't guaranteed after repetitive head traumas, we've seen that high-risk groups like athletes, military personnel, and survivors of domestic abuse face substantial higher odds due to the nature of their experiences. The latency periods between head injuries and symptoms onset highlights an urgent need for awareness, not just about the immediate dangers of concussions, but about long-term brain health and how it's impacted. Okay, let's go to the next segment. Next segment is gonna be segment 4, symptoms. How does it affect your life? CTE, or chronic traumatic encephalopathy, is often called a silent attacker because it operates in the background for years, sometimes decades, before rearing its ugly head in ways that profoundly change a person's personality, behavior, and overall functionality. One of the trickiest aspects is that early symptoms are vague and often easily overlooked. They often mimic other conditions like depression, anxiety, or age-related forgetfulness. As CTE progresses, these symptoms can become more severe and debilitating and impact nearly every aspect of a person's life. Stages of CTE. Let's get into the stages. Researchers have organized the progression of CTE into stages based on the severity and outcome. Let's break it down. Stage 1 is the early symptoms. During stage 1, symptoms are mild, but may start interfering with day-to-day life. These often include mood swings, sudden or unpredictable changes in mood, such as irritability or frustration, even in calm situations. Headaches. Chronic headaches, sometimes described as migraines, are common and early indication of brain injury-related inflammation. Confusion. A person may feel disoriented or unsure about tasks they used to perform easily. Impulsiveness. Poor impulse control begins to show. This could manifest as risky behaviors, careless spending, or reckless interpersonal dynamics. At this stage, these changes might not raise any red flags for a neurodegenerative condition. They are often attributed to stress, burnout, or other mental health conditions. So if you look at all those symptoms, it's very easy to see this could be related to A, B, C, or D, but not CTE, right? So it's why it's very challenging to put this all together, because these symptoms mimic so many other conditions. Let's look at stage 2, moderate symptoms. In stage 2, the symptoms deepen and become harder to ignore. This is where relationships, career performance, and mental health can really begin to deteriorate. Depression. Clinical depression becomes a common feature, often accompanied by feelings of hopelessness or worthlessness. Memory lapses. Difficulty recalling information, names, or recent events may emerge. These memory issues are not pronounced as dementia, but are noticeable. Aggression. Increased irritability often progresses to outright aggression or hostile behavior. This person may act impulsively, and they may present with some confrontation situations, even when it's a calm and it's a mundane situation. They might have these over-the-top outbursts. Difficulty focusing. Cognitive abilities such as attention spans and focus deteriorate. Tasks that require sustained mental effort can become frustrating or impossible. Symptoms like aggression and memory lapses can cause family strain, work instability, and the onset of embarrassment or isolation in social settings. Okay, next let's talk about stage 3 to 4, late symptoms, severe cognitive decline. This is where the disease hits hard. Late stages CTE symptoms mimic those of dementia and other severe neurodegenerative diseases. Severe cognitive decline, people may lose the ability to reason, problem solve, or comprehend concepts they previously mastered. Speech problems, aphasia, can develop, leading to struggling with speaking clearly or even understanding language. Motor dysfunction, coordination issues become pronounced, often resembling Parkinson's symptoms, such as tremors or rigidity. Memory loss and confusion. Profound forgetfulness renders basic daily life tasks like managing finances or recognizing loved ones extremely difficult. At these stages, individuals may need caregivers, and their ability to focus and function will drastically decline. Alongside these dramatic changes, personality shifts can take a sharp negative turn. The emotional impact of this personality and psychological changes. So one of the most heartbreaking aspects of CTE is how it reshapes the emotional core of the victims. And let's face it, these people are victims, right? They didn't ask to have head trauma, and they didn't ask for these changes. They are victims because it's affecting them, and it's the people are around them are victims as well, because it's the person, and then everybody else becomes the victim, because now you've affected your life, and now these outbursts, these personality changes are affecting everybody around them. Many families describe their loved ones as becoming completely different people over time. This emotional and psychological toll includes radical personality changes. A person who was once calm, measured, or cheerful may become angry, violent, paranoid, or deeply withdrawn. Paranoia. Many CTE sufferers develop irrational fears, including mistrust of family and friends. Aggression, outbursts of inexplainable anger or hostility towards loved ones or strangers are very common. Suicidal thoughts or behaviors. Tragically, CTE has a strong association with depression and suicide. The linkage has been studied extensively in former athletes and veterans, particularly those with histories of concussion or repetitive trauma. These emotional shifts often leave loved ones feeling helpless, confused, or even alienated as they struggle to understand the behavioral changes that seem entirely out of character for the person they knew their whole life. Let's look at how the symptoms expand beyond the brain. While CTE primarily impacts the brain, the ripple effects extends to the entire body and the quality of life. As the brain function deteriorates, physical health can follow in ways such as sleep disorders. You can have an insomnia, or other sleep disturbances are common, often aggravated mood and cognitive issues. Fatigue, chronic fatigue caused by neurological dysfunction can lead people unmotivated to engage in daily life. Social withdrawal, a combination of cognitive decline, emotional instability, and paranoia frequently lead to isolation, even from close relationships. Why symptoms are so difficult to diagnose early. Many individuals of these symptoms overlap with other conditions like Alzheimer's disease, PTSD, or even mental health issues like bipolar disorders. This overlap makes it extremely difficult to diagnose CTE during someone's lifetime, especially in the early stages. This is why research into biomarkers and brain imaging is so critical. Catching the disease early could help manage symptoms before they reach debilitating levels. Let me wrap up this segment. So, how does CTE affect your life? Starting subtle and gradual, it infiltrates your emotional core, your cognitive abilities, and your relationships. By the time CTE reaches later stages, the person you once knew, their personality, the daily interactions may feel completely transformed and foreign. Perhaps the most tragic are those affected by CTE are often caught in a cycle of misunderstanding and misdiagnosis, causing delays in care and support. So let's get into segment 5, really break down how you get CTE. I know we've talked about head traumas in the past, but let's get into the deep dive of it. One of the most pressing questions surrounding chronic traumatic encephalopathy is, how does someone develop it? While CTE is primarily linked to repetitive head trauma, the mechanism behind its onset are nuanced, and not every head trauma results in this condition. In this segment, we're going to break down the contributing factors, the types of trauma that increase the risks, and why age and frequency play such a crucial role. Primary cause is going to be head trauma. Now, some of this we've previously talked about, but this is going to get into a little bit more detail. Again, this is going to be an ultimate dive. So some of it you're going to hear a little bit earlier, and I'm going to get into it a little bit more now. So CTE develops over time due to repetitive trauma to the brain, such as concussions or smaller, seemingly insignificant hits, also known as subconcussive hits. While each injury, the brain is subjected to physical forces that disrupt its delicate structure and trigger damaging biochemical processes, eventually laying the foundation for CTE. These injuries can occur in a variety of contexts. Again, we've mentioned this: contact sports, military, domestic abuse. One of the ones we haven't mentioned is workplace or recreational activities with frequent head trauma, such as construction or extreme sports. So when we talk about head trauma, the brain experiences trauma, severe biological processes occur that can lead to CTE long term. Mechanical forces. The force of the head causes the brain to move within the skull, stretching or tearing axons, the parts of the brain cells responsible for transmitting signals. The inflammatory response. The brain responds to trauma with localized inflammation, which may further damage the surrounding tissues over time. The tau protein's dysregulation. Repetitive injuries increase the likelihood of tau proteins becoming hypophosphorylated, leading to those dangerous tau tangles. The cumulative effect of these processes lead to irreversible damage, particularly when trauma occurs over extended time. CTE doesn't develop overnight, and not everyone who experiences head trauma will develop this condition. Let's explore the specific risks that influence someone's level of vulnerability. Repetitive concussions. I want to emphasize that it is often repeated concussions, not one single instance of head trauma, that raises the risk of CTE. Subconcussive impacts, which do not cause obvious symptoms like unconsciousness or confusion, can still accumulate damage over time. These silent hits are especially dangerous because they often go unnoticed and untreated. In sports like football or soccer, athletes endure hundreds or even thousands of subconcussive impacts that annually during the practices and games. While these hits appear harmless at the moment, the repeated strain on the brain sets the stage for tau protein buildup or tangles and long-term neurological damage. The severity of trauma. While repetition is critical, the severity of each traumatic impact also plays a major role. Mild trauma may seem insignificant, but over time, it can lead to the same damage effect as a single severe concussion. Severe trauma, especially when it involves the loss of consciousness or confusion immediately after an injury, speeds up the brain damage and increases the likelihood of early symptom onset. For example, a professional boxer who sustains a high impact punches directly to the head often shows signs of CTE earlier in their lives compared to athletes in sports like soccer who experience only subconcussive impacts. The age of first exposure. We talked about this a little bit. Let's get into it a little bit more. This is one of the more critical aspects of this. The younger someone is when they have their first head trauma, the more vulnerable they are in developing brain problems or long-term damage. So let's break it down. Pediatric brains, those underneath the age of 18 are still growing and organizing connections between neurons. So if you're under 18, you're considered to have a pediatric brain and your body is still developing. So traumas during this critical period can disrupt normal brain development, making younger athletes more susceptible to developing CTE later in life. Early exposure. Less than 12 years old, studies suggest that exposure to repeated head impacts, including periods of playing contact sports before the age of 12, significantly increase the risk of developing CTE symptoms early and more severely. Adults who experience their first concussion in their 20s or later tend to be less vulnerable as the brains are fully developed. Additional factors influencing the risk. So it's not just frequency, severity, or age of the exposure that determines someone's likelihood of developing CTE. Other factors play a role too. Duration of exposure. So the longer someone is exposed to repetitive trauma, the greater their risks. Athletes who play contact sports professionally for a decade or longer are far more likely to develop CTEs than amateur players with shorter exposure. Similarly, a career military person or individual in dangerous professions are disproportionately affected due to long-term exposure and trauma over many years. Recovery times between injuries. Lack of adequate recovery affects traumatic episodes, whether it's weeks or months, is another risk factor. So when the brain doesn't get enough time to heal properly, subsequent injuries compound the damage exponentially. Genetics. Emerging research suggests that genetics may influence the susceptibility to CTEs. For an instance, variants in certain genes like APOE4, which are associated with Alzheimer's disease, may also be linked to higher likelihood of traumatic-related brain conditions. While genetics alone don't cause CTE, they can modify how the brain responds to injuries, potentially accelerating the tau protein's buildup and degeneration. Okay, let's wrap up segment 5. How do you get CTE? The answer lies not just in experiencing head traumas, but in experiencing repetitive traumas, often smaller subconcussive forces that accumulate over years. The severity of the injury, the age at which it starts, and the frequency of the exposure all play critical roles in determining whether or not someone will develop CTE later in life. And as we've learned, even individuals who appear asymptomatic after head injuries may still be at risk due to the silent long-term damage happening inside their brain. Prevention is key, minimizing repetitive traumas, monitoring recovery times, and limiting exposure in vulnerable populations can make all the difference in reducing their risk to this devastating condition. Let's go to segment 6, diagnosing CTEs, the current challenges. This next part is one of the most frustrating aspects of chronic traumatic encephalopathy. It remains impossible to definitively diagnose CTE in living patients. Right now, the diagnosis can only be made post-mortem. So only when someone passes and you examine their brain is when you can actually diagnose someone with this condition. This limitation makes it incredibly difficult to identify and treat CTE early, leaving patients and families trapped in uncertainty. Okay, so why is CTE so hard to diagnose? There are several reasons why diagnosing CTE during someone's living life remains a challenge. So definitive diagnosis requires autopsy, right? The only way we can definitively confirm CTE is by examining someone's brain after they have passed. Scientists have looked into their hallmark features, such as abnormal deposits of hyperphosphonated tau proteins, which form tangles in the neurons, the unique pattern of the tau tangles concentrated in areas like the frontal and temporal lobe, brain shrinkage, and evidence of chronic inflammation. This means that throughout life, individuals might live with symptoms and suspicions of CTE, but they and their doctors will never know truly until an autopsy is performed. Symptoms overlap with other conditions. So what makes the diagnosing CTE particularly tricky is that its symptoms like mood swings, memory problems, aggression, cognitive decline mimic other neurological or psychiatric conditions such as Alzheimer's, Parkinson's disease, post-traumatic stress disorder, dementia, even depression, anxiety, or bipolar disorders. Doctors have no objective test to definitively diagnose CTE from other conditions, which means their symptoms alone are not sufficient for diagnosis. Lack of real-time markers. CTE takes years or even decades to manifest after a head trauma, making it a silent disease without visible or measurable markers in living patients. Those with the other diseases like diabetes, we're going to look at blood sugar, or cardiac, we're going to look at blood pressures and other conditions. It's extremely hard to track the presence of the CTE and the progression of the disease because you don't have a marker to identify it. You don't have a cause. Okay, like for diabetes, my A1C is high, so then I know I have diabetes. You don't have those markers with CTE, which makes it very difficult to diagnose, especially with the overlap of other conditions. So how researchers are tackling this problem. Despite these challenges, the scientific community is working tirelessly to find ways to diagnose CTE early in living patients. Here's what holds the most promise. Biomarkers. Detecting chemical traces. One of the most exciting areas of research involves identifying biomarkers, biological indicators that can reveal their presence of early disease. CTE researchers are looking for certain tau-related proteins in the blood or cerebral spinal fluid that are linked to the accumulation of tau tangles in the brain. Neurofilament light chains, NFL. When neurons are damaged, like in head trauma, they release NFL into the bloodstream or CSF. Elevated levels could serve as warning signs for degenerative brain disease like CTE. Neurofilament light chains, NFL. That's very interesting. Inflammatory markers. Chronic inflammation is often present in the brain of individuals with CTE. So researchers are exploring proteins that indicate inflammation in the brain. Although blood and CSF tests for biomarkers are still experimental, they could one day offer non-invasive early diagnosis. Imagine a simple blood test that could reveal this risk early sign of CTE. That would be a game changer. Okay, next thing that we're going to talk about is advanced brain imaging. Seeing CTE in real time. Another promising area of research lies in imaging technology. Current brain scans like CTs and MRIs are not sensitive enough to pick up tau deposits or the microscopic brain damage typical of CTE, but newer techniques are attempting to fill the gap. positron emissions tomography, or a PET scan. Researchers are developing specialized PET tracers that can bind to tau proteins when injected into living patients. These tracers allow tau tangles to light up on the PET scan, providing a way to visualize and measure the tau buildup in the brain. Early studies using tau tracers have shown promising results in identifying the areas of the tau accumulation in patients with suspected CTEs. Diffusion tension imaging, DTI, a specialized form of MRI that measures the integrity of the white matter in the brain. Damage to white matter, commonly seen in CTEs, can be detected using this advanced imaging technique. Lastly, we're going to look at functional MRI, fMRI. This tool maps brain activity in real time, and researchers explore ways to use it for identifying changes linked to CTE. While these imaging techniques are still experimental, they represent a major step towards diagnosing CTE in living patients. Neurocognitive test. Another emerging field involves more sophisticated neurocognitive testing to look for subtle signs of CTE-related impairment. These tests assess changes in reaction time and reflexes, decision-making abilities, memory, and language processing. When combined with medical history, past events, and behavioral shifts, these tests can provide clues to who is at risk for developing CTE. What are the current limitations in diagnosing CTE? While these diagnostic advancements are exciting, many hurdles remain. Lack of standardization. There is no universal agreed upon way to diagnose or predict CTEs in living patients. Even experimental techniques are widely varied. Overlap with other diseases. Tau imagings and biomarker testings are still being redefined to better differentiate CTE from conditions like Alzheimer's disease and Parkinson's and PTSD. Accessibility. Advanced imaging technologies like tau PET scans are not widely available and are still very expensive, limiting their use in clinical studies. Further direction. The ultimate goal is to develop a reliable and non-invasive way to diagnose this condition, like a blood test, brain scan, or combined cognitive assessment that can easily identify it. That is the future that we want to try to find, and that's what the researchers are looking to do. Early detection would open the door for treatment strategies that could delay or prevent progression. So let's wrap up segment 6. The big takeaway is CTE currently cannot be definitively diagnosed in living patients, but there is exciting new advancements on the horizon. Biomarkers and advanced imaging technologies hold the potential to revolutionize how we identify and monitor this condition, long before it reaches its debilitating stages. Until then, it is crucial to focus on prevention, monitoring high-risk individuals, and raising awareness about the dangers of repetitive head traumas. Segment 7, we're going to talk about treatment, conservative, non-conservative approaches. So let's talk about solutions. Even though the reality here is sobering, CTE has no cure. Treatment mainly focuses on managing symptoms rather than reversing the disease. Conservative treatments. Psychological therapy, like cognitive behavior therapy, CBT, can help manage mood swings, aggression, and depression. Medications like antidepressants, mood stabilizers, or anti-anxiety medications. Lifestyle modifications, including regular exercise, stress management, and implementing healthy sleep habits, help to improve brain health. Non-conservative treatments. Experimental treatments. Cutting-edge research is exploring ways to address tau accumulations in the brain, such as immunotherapy, using antibodies to target tau proteins in the brain. Gene therapy, manipulating genetic pathways to prevent tail formations. Additionally, there is emerging interest in the role of diet and supplements such as omega-3 fatty acids, antioxidants, and anti-inflammatory substances. Okay, let's bring it all together. So where do we stand? CTE is a devastating condition that still has a cloud of mystery. It's preventable in theory by minimizing repetitive head traumas, but the lack of early diagnosis and treatments make it difficult to battle. There is hope. Advances in science are paving the way for better understanding, detection, and intervention. Until we get there, raising awareness about the dangers of repetitive brain injuries and supporting those affected must remain a priority. So as I say with all my shows, the information that I've given you here is my opinion and my opinion alone. Please do not take anything I have given you as far as information as diagnosing you, giving you treatment, or anything to that effect. This is just my opinion and me giving you information. If you have had a brain injury or a family member who's had a brain injury or a traumatic injury, or you're worried about this condition, please consult your physician, as they would be the ones to best get on top of this condition for you. Early detection is best. If you know anybody who has any kind of conditions or has had played sports, or you're noticing any condition and you think this can help them, please pass this podcast along to them. The information that we have here, I did a really deep dive into this, and hopefully I can give somebody some information to help them and take them into the next journey to better understanding what's going on. As I say always, we get one life. Please focus on it. Please do the best you can. Stay healthy, stay informed. Until next time, Dr. Michael CTE out. Be well, be safe, be healthy.